Hi! How are you, Summer? My name is Dr. Gopika Gangupantula, but most of my patients call me Dr. G. I am a diabetes specialist, a diabetologist with a primary degree in family medicine. I practice in Modesto in the Central Valley of California. Hola, señor.
Buenos días.
Yo hablar poquito español, no mucho, es muchas medical español. Okay. My mom is a retired physician, and I used to be always in awe of what she does, and I always wanted to become someone like her to help people, how she helped so many people. My dad, he was a huge part in inspiring me to be a good doctor. My dad got diabetes and he was diagnosed at a very young age. To watch him go through it as a child, I didn't understand what was happening. And it was very difficult in those days for a diabetic to get the proper treatment because there was not much available as far as educational material. And I saw them struggle through it. It inspired me a lot to study more about diabetes and help people like him. In 2019, a year after my dad passed, I dedicated my practice to him, and I always think about him. He's always there in my mind and my heart because he was the biggest part growing up to encourage me all the time. I met my husband very unexpectedly.
This would be as traditional as it gets, I guess, from an Indian context point of view. We did get married as an arranged marriage. We saw each other, and 10 days later we got engaged, and another week later we got married.
It was a tough journey, and we came here because he was already here. I was already doing some specialty training, and to drop it and come here was quite difficult. Whether I lived in India or here, I was going to help people. That much I knew. It was just my husband and I for many, many years. After I had my kids, it started getting more and more difficult. With the help of my husband, I was able to find that balance, and I have been able to maintain the traditional part of my culture in my family inside the house, and I have been able to teach my children to learn a lot about our culture. The culture that we follow helps us to stay grounded to our roots. Even though it was a difficult journey, we have found it, and we are quite happy of what we are doing, where we are now. I saw the rise in diabetes cases in the Central Valley. I knew together we can make a difference in this community to help people with diabetes.
I realized that she would need help on a much larger scale, so I decided to change my career, and I took care of the business starting off.
My husband started his training in healthcare MBA, and he has stayed with me, and he has helped me grow this practice, and that is a huge part. I'm just blessed to have him.
For her to continue to support the patients that she wants to support and the care she wants to give, it was important for me to make sure that I can take care of the rest of the complications.
Well, let's see. She is the best doctor that I've come to know in all my life, and I'm very old. I've been around.
The best part of the practice for me is to help my patients understand and educate them about their condition, why and how, and so many medications that we have nowadays to treat their condition.
This is a community that needs more than just the words diet and exercise. It needs to explain what that looks like. It needs a doctor that's willing to sit and listen to what the patient needs.
Come to exercise. Now, if you're not able to walk, it's okay. I want you to find some chair exercises for him, upper body exercises, something to do every day on a regular basis.
I've had the privilege of being one of her patients for over 5 years now. My glucose levels were high. They are now down to what I feel are very manageable.
She is very compassionate with patients. She doesn't care about the time limit. And basically, it's more of the quality of patient care.
She takes a long time, okay? But that's because she cares about your health and she's there to help us.
She takes plenty of time, which is what patients really oftentimes need.
She's so approachable and she's so kind and compassionate that it's very easy for the patients to open up and to tell her exactly what the problem is and why they think their diabetes is not being well controlled.
When I came to her, my blood sugar and my overall health was going really south fast. She managed everything to control within a year, within 6 months. I was back on track. I'm enjoying life, and hopefully I'll be around for a while longer.
Seeing my dad struggle and his journey all through his life to keep himself healthy has helped me understand what patients with diabetes go through and what their families go through. And I'm just grateful to be part of their journey to keep them healthy.
Congratulations on this awesome award.
Congratulations, doctor. You have earned it.
I'm so proud of her and I'm just admiring her, hoping that someday I will be like her.
Dr. G, you absolutely deserve it. Your patients love you, your staff loves you. I, of course, cannot be more grateful for everything you've done for me.
Dr. G, congratulations. I'm not surprised. You are an amazing doctor.
If there is a deserving doctor, let me tell you, it's going to be you. And I know you love your patients so very much.
I cannot think of a better person who deserves this award. You've earned it.
Congratulations, Dr. G. You really deserve this. I'm really, really happy.
We're so proud of you. We're so happy. We want to congratulate you. You worked so hard for everything. You deserve this.
We love you so much, and we're so incredibly proud of you.
Your lifetime of hard work has made you an inspiration to our family and to physicians everywhere.
Congratulations, Dr. G.